So I'm going to be talking about the sexual health of gay migrants, and I need to apologise up front that this is really and exclusively a talk about gay men, because really there just isn't the data available to talk about gay women. But I think you've already very eloquently and beautifully kind of expressed some of the issues, and I think many of the motivations and reasons for migrating will apply equally to gay men and gay women, but this is predominantly a talk about gay men. In the UK, it's estimated that there are sort of 500,000 plus men who have sex with men, which is roughly about 3.4% of the adult population. And what we know is that 40,000 men who have sex with men. So we use the term men who have sex with men as opposed to gay men, or they're often interchangeable, because not all men who have sex with other men identify as being gay, and so the sort of term that we use within the sexual health world is men who have sex with men. So that's what MSM stands for. So 40,000 MSM live with HIV in the UK, of whom 26%, so a quarter, are unaware of their HIV infection. To put that in perspective, approximately 100,000 people are estimated to be living with HIV infection, and in fact undiagnosed infection is higher in other communities. We know that the majority of men who are diagnosed are on therapy, and of course therapy is important because we know that that will reduce your infectiousness and also changes on the whole people's behaviour. So the vast majority of transmissions occur in people who are either unaware, well, we believe are unaware of their infection, and probably in the early stages of infection, because that's when your viral load, your amount of virus in your blood is highest and you're the most infectious. So a lot of the sort of campaigns around sexual health are around testing and knowing your status. There has been a very definite increase in the number of HIV diagnoses amongst Central and Eastern European MSM since 2004, but the numbers, fortunately, remain small. I'm sure you're all aware that sort of the collapse of communism was really heralded with a very marked increase in HIV and STIs across much of the region, but probably not so much in many of the accession countries in which we've seen the very large numbers of migration coming to the UK. In terms of the accession countries, the exceptions to that in terms of HIV would be Latvia and Estonia. And I think what's particularly concerning is the data would suggest that almost all of those infections are probably acquired within the UK, so post-migration. The proportion of people who are diagnosed late, and actually that's lower in Central and Eastern Europeans than it is amongst other gay men. So that's a good thing that they've been diagnosed earlier, that has better health outcomes for themselves as well as a public health prevention, but obviously ideally, we would like to not have increasing numbers of infections. Of course, we're having increasing numbers of migrants, so proportionately it's hard to tease that out. So this is just sort of bringing some context into the London focus of tonight's talk. Within London, the vast majority of boroughs have very high rates of HIV, diagnosed HIV infection, and what we know is that those boroughs that have the most deprivation of those boroughs that have the most HIV. Lambeth actually has the highest HIV prevalence in the UK. It's over 1% of the adult population, which is remarkably high. It is also believed to have the largest population of men who have sex with men in the UK. And sex between men is the most common route in London, in fact, in the UK, for HIV and certain STIs. So 54% of all new HIV diagnoses are amongst MSM, 84% of syphilis diagnoses and gonorrhea, and I haven't even talked about hepatitis C. I haven't got any data, but there's an awful lot of that about as well. So that brings me to the Celly Project, which Richard has kindly already introduced. That stood for the Sexual Attitudes and Lifestyles of London's Eastern Europeans. This data, of course, is now 5.5 years old. We conducted it back in 2009. We recruited the majority of these people through an internet survey. We ran banners on, at the time, two popular websites, Gay Romeo and Gaydar, in which we sort of had click-through banners or advertising. The survey was relatively short, took about 10 minutes, and was available in all of the relevant languages. We also supplemented that with some in-depth interviews to try and sort of get a contextual understanding of what was going on. And the definition of a migrant was people had to self-identify as a migrant from one of the 10 accession states. And we deliberately chose people from the accession states because we didn't want to sort of run into any sort of entitlement issues to NHS services. In terms of the internet sample, the mean age was 29, so young, as it was in keeping with all migrants at the time. The vast majority were within London from the first batch of accession countries, and Poland dominated by far. Most had been in London for over a year, very well educated, 55% had a degree, and 5% reported that they were HIV positive. Now, the Sigma survey was another internet sample of all gay men in London, or in the UK, and actually you can see that the Celly data shows that the reported prevalence was substantially lower than that reported in the Sigma data. Just looking at service utilisation, looking at those people living in London to elsewhere, because I think London is a kind of entity in itself, and the people who live here differ both because of the services and access to things that aren't available elsewhere, but something about the city, I think, also possibly impacts on behaviour. So we see that people living in London were substantially more likely to have ever HIV tested. So just over half of the men had. A third had been diagnosed with a sexually transmitted infection. That probably sounds like a lot, but would be lower, is a lower number than would be reported in a general survey. And as I said, the reported HIV positivity rate was higher in London than elsewhere. Looking at condom use, so of course that's very important in terms of sexual risk, in terms of transmission, and we see that the vast majority of people did report that they were having anal intercourse over the past year. Quite a substantial proportion of the men were reporting unprotected anal intercourse, which of course carries the highest risk for transmission of HIV and other STIs. Unprotected intercourse with a casual, non-concordant partner, so that's someone who's you either don't know their HIV status or it differs towards your own, compared to your own status, was also relatively high, with over a fifth of men reporting that. Unfortunately, we did see that was more common amongst our HIV positive cohort, but remember the numbers here are very small. But it was also very high amongst those men who were HIV negative or untested. And of course, when they say discordant, we didn't have any biological samples here, and often people's perception of what their partner's status is may be erroneous. Those numbers were lower than amongst a general survey. We saw that actually commercial sex was very high amongst this cohort, as was reporting injecting drug use and being paid for sex. What was interesting was that assortative sexual mixing, which is when you have sex with someone from your own community, was lower in London than elsewhere. I guess there's more range. We also saw that over time we can see an increase in risk behaviours, with more people paying for sex, using drugs. There's less assortative mixing, and of course because people are coming from countries with low prevalence to countries with higher prevalence, actually having sex with other people from other communities actually puts you at increased risk. In terms of what we found in our in-depth interviews, I think it very much reflected what you talked about in your talk, in that the motivation to migrate was often driven by social rather than economic factors, with many people reporting sort of negative experiences and hostility towards their sexuality at home. They felt they had to live a life underground, and there was sort of a lack of positive representation. So that was the key, or the dominant factor for migrating amongst this population. London was a very popular destination, huge, it's very liberal, there's lots of freedom, there's lots of access and range of gay venues. People did recognise that it was a riskier environment, but it didn't translate necessarily to an adoption of safer sex or appropriate behavioural adaptations. So really this is just, for some people it was like going into a lolly shop, a candy shop, the choice was overwhelming. For other people it was almost too much actually, and had the opposite effect, but the majority of people just were like, wow. We did feel that sexual behaviour was very much influenced by the migration process, and that the initial period, in the interviews what came out is that initial period when people first came was in particular a risky time for people, that sort of wow factor about living in London and the access to everything, but not yet with the kind of adoption of the social norms that were happening in the UK around sort of testing, around condom use, all of those things. There is a lot of risk behaviours reported, and I think people have been quite protected by the fact that in their home communities there isn't much HIV or hepatitis to be spreading around, but of course there's increased risk here in the UK. And what I haven't talked about, there's a lot of circular migration. So of course if people acquire things in the UK and then go home, it will have an impact on things back home.